the Midland County Board of Commissioners meeting to order Tuesday, March 17th, 2020. And will you call roll, please?
Commissioner Snyder.
Here.
Glazer.
Here.
Twilliger. Geisler.
Here.
Dorian.
Here.
Nosen.
Here.
Chairman Bo.
Here.
6 present, 1 absent.
Commissioner Glazer, would you lead us in the invocation and pledge, please?
Yes. Dear Lord, in these times of uncertainty and fear, I pray that your Holy Spirit will still our hearts, grant us this day the wisdom and discernment we need to get through this difficult time. I pray that you would grant health, wisdom, and courage to our political leaders, President Donald, Governor Gretchen, our Mayor Doreen, our Controller Bridget, to administer the policies and administrative affairs in their respective levels of government. And we also commend into your care the emergency service providers, our doctors, caregivers, and certainly, Lord, the families of those who will be contracting this disease. In Jesus we pray, amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next on the agenda is the approval of the minutes for March 3rd and March 10th of 2020.
Mr. Chairman, I recommend we approve both sets of minutes.
Support.
All those in favor, please say aye.
Aye.
Those
Aye.
opposed, the same. We will approve the minutes for March 3rd and March 10th of 2020 and move on to acceptance of the bills.
Properly addressed general bank claims approved for the weeks of February 17th through the 21st, $285,386.18, with total general fund expenditures $52,532.09. General bank claims for the weeks of February 24th through February 28th, $1,476,185.51, with total general fund expenditures $516,295.73.
Okay, yeah. Yeah, okay.
I'd like to move to accept the bills.
Do we have support?
Support.
All those in favor, please say aye.
Aye.
Those opposed, the same. Okay, we will approve the bills. We do not have a special program of the day. Do we have any public comment today on anything that is not on the agenda or on the consent agenda? Okay, seeing none. We are going to move right to, we have 2 items of new business today, and so in respect of the virus we're dealing with, we're going to move right to the new business so people that are here in attendance can leave and keep our crowds to a minimum. So if I could get a motion to take up 2 items of new business, I would appreciate that.
So moved.
Support.
All those in favor, please say aye.
Aye.
Those opposed, the same. Okay, and would you read the 2 items of new business, please?
The first one, new business number 1, properly addressed, ladies and gentlemen. I recommend waiving County Policy 101.3, Section 6.5, to allow for the reappointment of Douglas Ward to the Community Mental Health Services for Central Michigan Board. Mr. Ward will serve an 8th term from April 1st, 2020 through March 31st, 2023. I recommend waiving County Policy 101.3, Section 6.5, to allow for the reappointment of Yvonne Corbett to the Region 7 Area Agency on Aging Board of Directors. Ms. Corbett will serve a 7th term from April 1st, 2020 through March 31st, 2023. Respectfully submitted, James Geisler, Midland County Board of Commissioners.
Commissioner Geisler.
Mr. Chairman, I recommend the adoption of agenda item 28-3-20.
Do we have any public comment on this item? Do we have any commissioner discussion?
Mark, could I please just bring you up to date a little bit?
Sure, Yvonne, please come forward.
First of all, happy St. Patrick's Day.
Happy St. Patrick's Day.
I'm not Irish, but Dick is, so I have to follow suit. During the last 3 years, I have contracted several people. that I thought would be interested in being on our board. This didn't come to commit, they didn't want to commit to going to Bay City. Approximately 13 years ago, Leona Falkenstein asked me if I would consider serving on Region 7. At the time, the gentleman serving was on the board for many years, and his health was failing. Knowing Lee, she was determined to get me involved. She made sure I had the minutes and later attended the meetings. I agreed to step down on some other commitments and serve on Region 7. I know some feel it's time for a change, and change can be good if the new party is familiar with the happenings. Region 7 requires on the board to recognize the needs of seniors in their district, along with many programs available to them, and the needs of 11 counties they represent. It is also my responsibility to report monthly to the Midland County Council on the Aging with any changes that have taken place. 2 years ago, I had the privilege of accepting the Luce Award for my concerns and work for Midland County seniors. The monies that Region 7 distributes comes from the federal government, state, and local millage. The Old Soldiers Act was improved in 1940 to establish money for our seniors. The programs available under our senior laws are numerous: congregate meals, waiver, home-delivered meals, home repair for seniors, utilities assistance, prescription drug assistance, legal assistance, transportation. A new program is now is our pharmacy program, and St. Mary's in Saginaw was a pilot program for this. So now we have numbers that we will be going to other hospitals. What happens is the pharmacist, he contacts the people after they have left the hospital to make sure they are on the right medicines and the right time they take it. And we have found many flaws due to the fact that there are so many specialists in the field, and medicines do not always go to that place. The last program is a PACE program, and I know that this is a big program for everyone concerned. It is in the process of building a building, providing for the calliest and the poorest members of our society. The first building will be built at Port Huron. The area was chosen because of many seniors in this area do not have access to doctors, medical facilities, and it is also in our region. Three Rivers was given the contract for this $10 million building. Construction should begin in the summer or early fall. In another 2 years, Bad Axe will receive a similar building, but it will be on a smaller scale. If you have not seen or visited the Senior Center up to Sanford, you need to see that. It is a tribute to both Midland County and the seniors. It's just beautiful. The commissioners over here, many of you have been on the board many times. With being re-elected shows that people are content with your leadership. Therefore, change in this area is not accepted. However, once we find someone that is willing to take the time, become familiar with our seniors' needs, learn the responsibility of Region 7, a change will take place. I am constantly looking, and I would appreciate if you people do too. One of the things I am presenting at the board is my responsibility, along with the commissioners, to select a person who knows the needs of our seniors, become familiar with the program that is offered, and willing to step up and know the responsibility with the happenings of Region 7. If this person steps up, I am more than willing to help and acquaint them with the full details it takes to accept. It's not a fact that you can learn in this position. The first meeting, you will have to vote on a $3 million budget for just that month. And if you have no background at all, there's no way you can vote on a $3 million budget. So if you can think of somebody that can help us out, I would truly appreciate it. Are there any questions regarding Region 7? And I want to tell you too, I was at a meeting yesterday with our senior board here. I don't know, did Charlie get a hold of you, Bridget? Well, your seniors here are doing their job. We are not going to have congregate meals.
Yeah, I posted his press release. I asked him to send it to me, and we posted it on our Facebook
But
page.
the home delivered meals are going to go out. What they will do is be Monday, Wednesday, and Friday, and they'll be given 2 meals, one hot meal and one cold meal. Transportation will be down to a limited because of the recommendation of our government, as we can see here. So if you have no further questions, I certainly appreciate your appointment. And we have to look for somebody in the next 3 years.
Thanks,
Thank you
Siobhan.
very much.
All those in favor, please say aye. Aye. Those opposed, the same. Okay, we will approve. New business item number 1. Can we move on to number 2, please?
Dated March 17th, properly addressed, ladies and gentlemen, we, your Board of Commissioners, recommend approval of the attached COVID-19 sick leave policy 402.15 and the COVID-19 mandatory guidelines for all Midland County employees. We also give authority to the board chair, public health director, and administrative controller to make changes to these policies and procedures as they agree upon and are needed in response to this very fluid public health emergency. Respectfully submitted, Mark Bone, chairperson, Jeanette Snyder, Steve Glazer, Midland County Board of Commissioners, James Geisler, Eric Dorian, Scott Noson.
Commissioner Geisler.
Mr. Chairman, I recommend the adoption of agenda item 29-3-20.
Do we have any public comment on this item? Do we have any commissioner discussion? Commissioner Noson?
Yeah, I'm supportive of this. My only question is, ultimately, this whole body should be deciding, and I get the fact that you want to have 3 peoples because it's very fluid. I would recommend that we put a 1-year time limit on that small body, and we can revisit it again, but I don't want to set the precedent that we're in perpetuity, letting a small group of folks make some fairly important decisions. But I get the reason why.
Okay. I don't see a problem with that. Does that propose any problems?
No.
I don't think it does.
No, it doesn't
It's
for
only for
us.
dealing
And
with
let
this
me just
situation.
say that I certainly hope that we don't need to still be making changes to this in a year.
Yeah.
I do too.
So, and again, the point of, Mark, do you want me to
Yeah, you
address
can
this
go
now?
with, you can
Okay.
go.
At this point, because things are changing so rapidly and we are not getting information from the state prior to the public. So we're basically reacting. Emergency management and public health are not getting a heads up from Lansing before the public does. We're getting, we've been actually we've become aware of things in the media before we've gotten information from the state. So because things are changing so rapidly, we need to be able to react rapidly and not always wait for a full board meeting or the time to call a special meeting. And the authority that I've requested in this document is just related to this issue. I can tell you there are going to be things that we have to spend money on that we may not have budgeted, that we will come later and say, this is what we need to do now, amend our budget because we had to do A, B, and C. We have gotten some guidance from the state through Jen's office to make sure that is with any disaster or emergency that we start coding overtime and extra costs to things, trying to keep track of those things separately in the event that we can get any reimbursement from the state or the federal government. So we're going to be doing that and communicating that to others. So when we first started needing to address this, as it rapidly started to change last week, pulled together a team of my internal service people, so facilities, IT, Jen with emergency management, public health, HR, and the courts, in trying to come up with first off, address the issue of what's going to happen if people have to be home, right, and how we pay them, which is what this sick leave policy does. We very specifically called it an employee emergency pandemic COVID-19 sick leave policy because it only addresses this issue. If you have to stay home because you have influenza, you're going to use your annual leave like you normally would, right? But if you don't know, because you're showing symptoms that are similar to COVID-19, we want you to stay home. We don't want you to come in. We're going to pay you. And in the guidelines that are attached, we outline what we've really, I would say we spent at least 2 hours brainstorming with the guidance of public health, what we thought were going to be situations that we would need to be addressing. There are always going to be things that come up that we haven't addressed. that's sort of the guidance, that's the point of having the authority given to this small team. You know, Mark and Fred and I are not going to make decisions about how we pay people or what we pay people without involving HR, and we're not going to make decisions about the building without involving facilities. I mean, we aren't going to make decisions in a vacuum. We're going to get as much information as we can before you know, Fred and I come to Mark and say, this is what we want to do. Are you on board? And if not, let's go back to the drawing board. So, again, a lot of time was spent in crafting these documents. The courts have agreed to these documents also. What I'd like to, are there any specific questions on the policy or the guidelines that you have right now?
Looked good to me. I understand the drivers.
Okay, thank you. Eric?
I just have some concerns with 6.3. It just the way it reads, doesn't read very, I wish that was rephrased to clear up some of the ambiguity of as soon as possible is just kind of a, you know what I'm saying?
Yeah, unfortunately, because, you know, we don't know what someone's access is gonna be. I mean, we really do need to leave it sort of ambiguous because this is a rapidly changing issue. I don't know if someone could end up going to the hospital or having to be quarantined and maybe not have access to get to somebody. Hopefully a phone call would work, but I don't know what condition they're gonna be in when they're diagnosed. Maybe a family member could let us know, but my guess is it's gonna be as soon as they know, they're gonna let us know because we don't want them in here, they're not gonna come in here. And that sort of starts the clock ticking too for them getting paid.
It just reads to me like we're looking for a way to get out of paying somebody. That's just the way it comes across to me.
I'm sorry, yeah, because that is certainly not the intent of this at all, no.
The
I
opposite.
wanted to ask that.
No. Thank you, though, for
Sure.
the clarification.
Sure.
Any other concerns? I know this has been really fast, and I'm sorry you didn't get it before last night, but we were making changes to this even as things were coming down yesterday. Okay.
Before we vote, Fred or Jennifer, you're back there. Is there anything you feel you need to add or any updates or anything you can?
I'd actually like Jen to talk about the continuity of operations plan too before you vote, because it
Okay.
has a lot to,
Yes.
they're
Right.
intertwined, if that's
So if
okay.
you guys both give us a little, we'd
Just a
appreciate
quick
that.
comment, which is kind of parallel to the policy that was developed. In the event that COVID-19 is if you were exposed or diagnosed, this parallels what Public Health Authority has to do anyway. So, you know, what we're going to do is called, you know, contact tracing. So it's important that the employer know, because if you've been implicated with a case, there's going to be some quarantine, and you're going to be asked to stay home for 14 days, which is the incubation period of the disease. So this is just another supportive way that, as an employer, you're supporting the actions of public health by keeping that individual away from others. And, you know, essentially it comes down to the real common sense way that public health is trying to approach this. The more people you come in contact with, especially if you're at higher risk, the more chance you have of spreading the disease. So this is just in support of the already, you know, required by law public health actions, which keep you, if you were potentially exposed, away from others. So this is a true, I think from the county's standpoint, a generous benefit just to assure that we can do our job in an efficient way. Any other questions for me? Good.
Thanks, Fred, and thanks for,
I don't
Go
know
ahead.
if I'm off point, but have we had any indication of anybody showing up with their
We have submitted, as a county, we have submitted testing samples. And I can tell you at this point, the testing has criteria. You can't just show up at the emergency room and say, I want tested. You have to meet certain criteria only because we have a limited lab capacity at the state level. Lab capacity is growing daily. So I think you're going to see some more tests submitted. At this point, I can assure you, as of today's time and date, we do not have any positive COVID cases in the county. We are currently monitoring one individual who was associated with a different case from a different county. So we have one individual currently quarantined who's not symptomatic, who is staying home for his 14 days, his or her 14 days, just per public health law, so the disease, is attempted to be mitigated. But certainly we have no cases. We have submitted several tests through our healthcare system to the state lab. I would tell you at this point, most public health experts would say it's a matter of when rather than if. So certainly I think we anticipate more cases in the statewide, particularly when you look for them. So, but at this point, no.
We don't have the ability to perform that test here.
Health departments, largely, we are not equipped to do that sort of testing. There's appropriate personal protective equipment that you must wear, and that is not something that local public healths are doing. It's the onus goes on your local healthcare community to determine, and ours has done a great job with determining how they're going to process a person who needs to be tested so you don't implicate the rest of the facility. You just can't have hundreds of people showing up to ER because that renders your ER ineffective.
So you forward all that to the state?
We're involved in the testing process by assigning, we are kind of an extra layer in approval to make sure the sample meets criteria. So, but the healthcare system does all that sampling. We basically assign it a number to make sure it meets, another layer to make sure it meets criteria, and then it's forwarded to the state lab. I will tell you that that's expanding because now some private labs are getting involved to enhance the testing. So there's going to be more tests submitted, perhaps not following the same strict criteria. The state health department, as of this morning, is going to start testing the higher risk people. So those are directly associated, and the lower risk people will funnel through the private labs.
How long does it take them to make a decision?
The initial test, the initial call was 24 to 48 hours. Since they have a limited testing capacity, the last number we heard was up to 72 hours to process a test.
I understood that they had a new system that they could, in 4 hours, determine whether they were or were not.
There is constant laboratory technology evolving, but at this point, you're looking at still a 24 to 48 hour best case scenario at this point. It's changing, just like Bridget mentioned, it's changing rapidly in every facet. So of course, developing more lab capacity is very high on everyone's list, but with that, the more you look for something, the more you're likely to find it too. So there's some positives certainly with enhancing testing, it'll give us a better handle, but at this point, we're still somewhat limited.
Thank you.
Yeah, sure. Good.
I think it was answered.
Okay. Thank you.
Fred, thanks for all your hard work you've been putting in.
Good morning.
Good morning, Jennifer.
Last night, I did send out a copy of the Midland County Continuity of Operations Plan. That plan was basically written and has been approved already by this committee, so there's no action that's needed from the board on that. But that plan basically outlines those critical services that the county are supposed to continue to try to offer. So we've already identified those critical services, and it's basically written for possibly a situation like this. One of the planning scenarios is a pandemic. So based on this plan, it identifies those critical services, and then from there, we will determine, based on all of the information from the state, as far as the governor's orders is really kind of pushing a lot of these things through that information. We are working to make decisions that the best we can on continuing to offer services here at the county. So in addition to ensuring the capabilities of the county, it also ensures the capabilities of emergency services and supporting our first responders and our partnering agencies through emergency management, and also continuing to provide safety and services to the residents of the county. That's basically, and in general, that's what it does. It doesn't get into detail into each of the departments, but through some emails that were sent out yesterday across the county, we're trying to gather some of the information so that we can make informed decisions as our rules change. Does anybody have any questions?
Commissioner Nosen?
I just noticed reading through this on the last page, the succession, line of succession. I thought we had dealt with this, but evidently not. It says Chairman of Law Enforcement and Judiciary Committee.
Well, that was addressed in your board rules.
Yes.
Your board rules. This has not been updated since that committee was eliminated. So
Okay.
it's just by de facto, because it is in non-existence, it just skips to, we just have the two, chairman and vice chairman. And what we would probably do is the exact same order that we have for the EOC.
Yeah, so that basically is pulling information from the county emergency management resolution, which has been updated to reflect those new changes of committees.
Right.
So the three commissioners that we work with right now for activating this plan and declaring an emergency, the board chair, the chair of A&O, and then I think we ended up with the vice chair of A&O.
So-
That's still, that supersedes this.
Okay, but this document itself is almost 10 years old. It's 9 years old now.
Well, we've already come up with some things we need to modify.
Okay, that was
We
going to be
haven't
my
had time
question. Why
to-
not take this opportunity to,
Well, we are in the process.
and that will go through a regular process of
Yes, it will.
And after this event,
A&O,
I'm
I
sure we'll
think,
make
right?
lots of updates and changes.
Go through A&O, right?
Yes, it does.
Yep. Thank you.
Thank you, Jennifer. Also, thank you for all your hard work, too.
Thank you.
So, thanks. We've done public comment, we've done commissioner discussion, so Ann, I'm going to ask you to call roll, please.
Just hang on just a quick second here. Commissioner Dorian?
Yes.
Commissioner Noson?
Yes.
Commissioner Snyder?
Yes.
Commissioner Glazer?
Yes.
Commissioner Geisler?
Huh?
Commissioner Geisler?
Yes.
Chairman Bone?
Yes.
6 yes, 0 no, 1 absent.
Okay, thank you. That's it for our new business. We have already asked for public comment, so at this point, I would ask for a motion to approve the consent agenda.
So moved.
Do we have support?
Support. Support.
All those in favor, please say aye.
Aye.
Those opposed, the same. Okay, the consent agenda is approved, so we will move on to standing committee report number 1, please, Ann.
Dated March 13th, properly addressed, ladies and gentlemen. We, your Administration Operations Committee, have reviewed the request to utilize the second choice among 2020 aerial bidders after the contractor that was originally selected was determined to be unable to meet their contractual obligations. We recommend approval of the agreement with ARG Flight Services Incorporated for the provision of aerial larviciding services. The term of this agreement is from April 1st, 2020 through August 1st, 2020. Respectfully submitted, James Geisler, Chairperson, Scott Nelson, Eric Dorian, Administration Operations Committee.
Commissioner Geisler.
Mr. Chairman, the A&O Committee recommends adoption of Agenda Item 12-2-20.
Do we have any public comment on this item? Any commissioner discussion? Ann, call roll, please.
Commissioner Snyder?
Yes.
Glazer?
Yes.
Geisler?
Yes.
Dorian?
Yes.
Noson?
Yes.
Chairman Bone?
Yes.
6 yes, 0 no, 1 absent, motion carries.
Committee report number 2, please.
Dated March 13th, properly addressed, ladies and gentlemen, we, your Administration Operations Committee, recommend approval of the My Deal Participation Agreement with Staples Contract and Commercial LLC. The term of this agreement is from March 1st, 2020 through May 31st, 2022. Respectfully submitted, James Geisler, Chairperson, Scott Noson, Eric Dorian, Administration Operations Committee.
Commissioner Geisler.
Mr. Chairman, the A&O Committee recommends adoption of item number 24-3-20.
Do we have any public comment on this item? Do we have any commissioner discussion? And call roll, please.
Commissioner Glazer?
Yes.
Geisler?
Yes.
Dorian?
Yes.
Noson?
Yes.
Snyder?
Yes.
Chairman Bone?
Yes.
6 yes, motion carries.
Committee report number 3, please.
Dated March 13th, properly addressed, ladies and gentlemen, we, your Administration Operations Committee, have reviewed the lease agreement with Midland Ford for a replacement vehicle for the Sheriff's Office. The term of this agreement is for 39 months, which begins upon delivery of the vehicle. We recommend authorizing the Administrator Controller to sign the lease agreement. Respectfully submitted, James Geisler, Chairperson, Scott Noson, Eric Dorian, Administration Operations Committee.
Commissioner Geisler.
Mr. Chairman, the A&O Committee recommends adoption of Agenda Item 26-3-20.
Do we have any public comment on this item? Do we have any commissioner discussion? And call roll, please.
Commissioner Geisler.
Yes.
Dorian.
Yes.
Noson.
Yes.
Snyder.
Yes.
Glazer.
Yes.
Chairman Bone.
Yes.
Motion, 6 yes, motion carries.
Committee report number 4, please.
Dated March 13th, properly addressed, ladies and gentlemen, we, your Administration Operations Committee and the Finance Committee, have reviewed the grant award from the Midland Area Community Foundation Access to Recreation Committee in the amount of $2,000. This grant will provide for the purchase of an amphibious wheelchair for use at Sanford Lake Park. We recommend approval of this grant and that the Administrator Controller be authorized to amend the 2020 budget accordingly. Respectfully submitted, James Geisler, Chairperson, Scott Noson, Eric Dorian, Administration Operations Committee, Scott Noson, Chairperson, James Geisler, Jeanette Snyder, Finance Committee.
Commissioner Geisler.
Mr. Chairman, the A&O Committee recommends the adoption of Agenda Item 25-3-20.
Commissioner Noson.
Mr. Chairman, the Finance Committee also recommends adoption of agenda item 25-3-20.
Do we have any public comment on this item? Do we have any commissioner discussion? And call roll, please.
Commissioner Geisler?
Yes.
Dorian?
Yes.
Noson?
Yes.
Snyder?
Yes.
Glazer?
Yes.
Chairman Bone?
Yes.
6 yes, motion carries.
Committee report number 5, please.
Dated March 13th, properly addressed, ladies and gentlemen. We, your Administration Operations Committee and the Finance Committee, have reviewed the 2020 Veteran Service Fund Grant Award from the Michigan Veterans Affairs Agency. The term of this agreement is from October 1st, 2019 through September 30th, 2020. The grant award is for up to $54,213 to cover the cost of the Veteran Service Officer position, which will be funded entirely through grant funds. We recommend approval of the grant and that the Administrator Controller be authorized to amend the 2020 budget accordingly. Respectfully submitted, James Geisler, Chairperson, Scott Noson, Eric Dorian, Administration Operations Committee, Scott Noson, Chairperson, James Geisler, Jeanette Snyder, Finance Committee.
Commissioner Geisler.
Mr. Chairman, the A&O Committee recommends the adoption of Agenda Item 27-3-20.
Commissioner Noson.
Mr. Chairman, the Finance Committee also recommends adoption of agenda item 27-3-20.
Do we have any public comment on this? Any commissioner discussion? And call roll, please.
Commissioner Dorian?
Yes.
Noson?
Yes.
Snyder?
Yes.
Glazer?
Yes.
Geisler?
Yes.
Chairman Bone?
Yes.
6 yes, motion carries.
Okay, that's it for our standing committee reports. We do not have any RPCs. We do not have any old business. We've done our new business, so we're going to move on to commissioner comments and start with Commissioner Dorian today.
Happy St. Patrick's Day, everyone, and be as safe as you can. Keep your distance.
Thank you. Commissioner Noson?
Ditto.
Commissioner Snyder?
I just want to say I appreciate the county that's directly involved with this virus and the efforts that they're doing. I appreciate it for our community. Thank you.
Thank you. Commissioner Glazer?
I have nothing else to add. Thank you.
Thank you. Commissioner Geisler?
No comment.
Thank you. And just going along with safety, what I'd like to do is if we need to have any committee meetings, this is my comment, committee meetings in the future, if we could refrain from using the fishbowl because it's a smaller confined area. And so AO, Finance, Human Services, if you guys would all meet here. And if it's not necessary to have that meeting, maybe we reconsider actually having the meeting. So, but let's be mindful and keep our 6-foot distance and everybody be safe. We're going to go on to commissioner meeting schedules, which hopefully a lot of them have been canceled. So Commissioner Dorian?
I assume that safety is still on for tomorrow at 11. Could I be wrong on that?
No, Suzanne and I talked about that. You're going to meet in this room.
In this room at 11 o'clock. And Human Services is scheduled to meet in this room on Monday, the 23rd at 2 o'clock. And that is all I have.
Commissioner Noson?
Yes, we have a special retirement board meeting at 2 p.m. on Wednesday. Looks like that may be via email.
That's correct.
And Finance Committee scheduled to meet at 1:30 on Tuesday, the 24th. Originally, I had planned on not being here for that. I have canceled both of my vacations, so I will be here, but it's good advice. We'll monitor the situation, decide if we need to meet at all. I do have a water asset management team meeting, and we're going to have to do something. It's on the 26th at 9:30, scheduled in Lansing. That may be virtual. And that's it.
Thank you. Commissioner Snyder?
All of my meetings have been canceled or are flexible except for finance, and I plan to be here for that if we have it.
Thank you. Commissioner Glazer?
Yes, tomorrow evening, I have a Homer Township Board. I'm not sure if they will meet, but I will plan to attend to give them an update and maintain safe distances. Mid-Michigan Community Action has been canceled on Thursday, the 26th, and I've received many notifications from Community Mental Health on delivery of services. I'm not sure if that committee will meet on Tuesday, the 31st, so we'll see.
Thank you.
And that will be it.
Commissioner Geisler?
A&O will meet at 2:30 on the 24th in this room. That's it.
Okay, thank you. All my meetings have been canceled. So that's the end of our business. Administrator Controller?
I just wanted to make one comment after hearing Steve talk about CMH. If you're unaware, we have not activated the EOC yet, but we have activated a virtual JIC, which is Joint Information Committee. So there are about 10 of us on a texting and email group distribution of public information officers, and we are sharing our releases to websites and social media. I've shared Council on Aging, I've shared CMH's, Dina is on the distribution list for that. 911, hospital, city, 211 also. So I think we've got a pretty broad range of information that we're trying to share on behalf of everybody else, so.
Thank you. I believe that's it.
Move to adjourn.
We have support. All those in favor, please say aye. Aye. Those opposed, the same. This meeting is adjourned until Tuesday, April 7th, 2020 at 9 a.m. to meet in a regular session of the Board of Commissioners and for the committees to resume their duties. Everybody have a good day and be safe. I'll let Jessica stand.